Starting from the beginning. 2. The Honorable Jessica Edmo, Workers' Compensation Judge, Colorado Division of Workers' Compensation. 2. True Blue, Employer and Self-Insured Carrier. 2. Gallagher Bassett, Third-Party Administrator, TPA, for True Blue. 2. Attorney Gail Benson, Pollard Miller, representing True Blue and Gallagher Bassett. Subject: urgent request for change of authorized treating physician. Hawk Starchild. Continuation of inadequate care and failure to provide appropriate specialized treatment. Dear Sir or Madam, this letter serves as a formal and urgent request for an immediate change in my authorized treating physician, Dr. Daniel G. Bates, for my workers' compensation claim related to my injury of February 20th, 2025. This request follows my direct communications yesterday morning, June 24th, 2025, with both the Division of Workers' Compensation and opposing counsel, during which I conveyed my intent to pursue this change after providing all relevant documentation to the opposing party. This request is made with full understanding of Colorado Revised Statute, Section 843404, 5A3, which outlines an injured worker's fundamental right to medical care. However, it is vital to grasp that this is not merely a standard request for a physician change. This is a demand. It stems from a continuing and unacceptable pattern of inadequate and inappropriate medical care authorized by True Blue as the self-insured carrier and administered by Gallagher Bassett. This pattern began with my initial assignment to Dr. Baker. As you are well aware, after the mistreatment by Dr. Baker, I was forced to wait 4 months with absolutely no authorized medical care beyond physical therapy. This prolonged delay in proper medical management was a direct failure on your part. This is especially true considering I was experiencing severe autonomic storms during that entire period without any specialized care. It is also critical to note that if I had any of the complex cervical spine, neurological, or autonomic conditions now being diagnosed, they would have definitively presented and been identified during my federally mandated 2-year medical certification, DOT physical, completed in October 2024. Furthermore, my sustained high level of physical activity and completion of 16 prior contracts, with the last one ending just a day before my injury, unequivocally confirm my robust physical health and the absence of any pre-existing conditions related to my current injuries prior to February 20th, 2025. You should be aware that my employer, True Blue, possessed a copy of this DOT physical, and it was logged in their system since early October. Now, Dr. Bates' care continues this unacceptable pattern. With Dr. Bates, things have started to feel alarmingly like I am dealing with Dr. Baker all over again. I am not willing to endure another 4 months of this unacceptable and detrimental situation. His treatment is demonstrably inadequate. It is biased, and it falls entirely outside his medical specialization for the severity and complexity of my injuries. This situation poses a significant and ongoing risk to my health. It directly impedes proper diagnosis and effective treatment. My urgent need for this change is based on a foundation of clear facts, irrefutable objective medical evidence, and Dr. Bates' profoundly unprofessional conduct during both encounters. This includes our most recent conversation just yesterday, June 24th, 2025, of which I have a recording. While I have not yet received his dictation from yesterday's visit, my assessment is based directly on that conversation and the undeniable medical necessity for a specialist. It should be specifically noted that I provided a physical copy of my DOT physical directly to Dr. Bates' office, despite their initial claim that they could not accept it since they didn't do the test. I informed them at that time that I had already provided copies of this critical document to both the Division of Workers' Compensation Court judge as well as opposing counsel, ensuring this crucial evidence of my pre-injury health is fully distributed and on record. Should there be any question regarding the recording, please be advised that under Colorado law, a patient is legally permitted to record a conversation with their doctor as long as one party to the conversation consents to the recording. Dr. Bates is not qualified for my complex injuries. Dr. Bates simply lacks the medical specialization required to properly manage the severity and complexity of my medical condition. Primary specialty disparity. Dr. Daniel G. Bates is a board-certified family medicine physician. While family medicine offers a broad foundational knowledge, it does not encompass the specialized, in-depth training necessary to accurately diagnose, assess, and manage the specific pathology of my cervical spine, nor its systemic neurological and autonomic consequences. Need for subspecialized expertise. My medical condition, as objectively proven by my MRI, involves findings that clearly require a specialist. These findings include severe left foraminal stenosis and moderate right foraminal stenosis at the C5-6 vertebral level. This means there is significant compression of nerve roots exiting my spinal column. This directly explains the radicular pain, paresthesias, numbness/tingling, and weakness I experience in both my upper extremities. Linear hyperintensity within the spinal cord at the C6/7 vertebral level, consistent with a prominent central canal or a small syrinx. A syrinx is a fluid-filled cavity inside the spinal cord. This is a grave and often trauma-induced pathological finding that demands the expertise of a board-certified neurologist or neurosurgeon for definitive diagnosis, careful monitoring, and potential intervention. This is unequivocally beyond the scope of general family medicine. Autonomic dysreflexia, autonomic storms, and associated cognitive dysfunction. These are well-known potential complications of spinal cord injury, SCI. My experience of multiple, severe autonomic storms and cognitive impairment demands a physician with specialized knowledge of the autonomic nervous system and its intricate connection to spinal cord integrity. This expertise primarily resides with neurology, physical medicine and rehabilitation, PM&R, or pain medicine specialists who have specific training in neuroautonomic disorders. Dr. Bates's training does not qualify him to appropriately assess or manage these complex neurological and systemic conditions. 2. Dr. Bates's unprofessional conduct and misrepresentation of my case. Dr. Bates's behavior has been consistently unprofessional and medically inappropriate. It shows a clear disregard for my well-being and the facts of my case. Arrival with pre-existing bias. When Dr. Bates entered the examination room, he did so with an apparent attitude, and notably, without any patient paperwork in hand. This immediately signaled a predetermined stance, indicating he had already formed conclusions based on information received from True Blue or Gallagher-Bassett. Fabrication of medical history. In his initial paperwork, Dr. Bates falsely claimed I had symptoms 2 days before my injury. I immediately brought this factual inaccuracy to his attention. This forced his office to correct my medical record. This deliberate misstatement, right from the start, shows an attempt to manipulate my medical history. Denial of MRI findings. During my examination, Dr. Bates inaccurately stated there was no disc bulging or anything on my MRI. This directly contradicts the official radiology report, which clearly details disc protrusions, osteophytes, and severe foraminal stenosis. His inability or unwillingness to acknowledge these objective, documented findings makes his entire assessment unreliable and medically indefensible. Attempt to sever causation. Neck versus arm symptoms. Crucially, Dr. Bates attempted to dismiss the direct causal link between my neck injury and my arm problems. He tried to separate my arm symptoms, which are clearly radicular in nature and directly attributable to the cervical spine compression shown on my MRI, from the neck condition itself. This deliberate attempt to fragment my symptoms is a clear effort to minimize the extent of the work-related injury and reduce the associated medical and disability claims. Pre-existing knowledge and bias from non-disclosed evidence. It is also deeply concerning that Dr. Bates demonstrated prior knowledge of my overall medical condition and claimed details before our examination, discussing aspects that I had never shared directly with his office. This information, including details referenced within the 4 different exhibits of audio records I previously submitted, specifically to opposing counsel, Gail Benson, and the Division of Workers' Compensation judge, could only have come from True Blue, as the self-insured employer/insurer, or Gallagher-Bassett, as their TPA. This explicitly indicates a pre-existing bias or influence on his medical assessment, rather than a purely objective evaluation focused solely on my patient presentation. Dismissal of life-threatening allergic reaction. I reported a severe, life-threatening allergic reaction, my throat was closing, anaphylaxis, to gabapentin he prescribed. While I agreed neither of us could have foreseen this specific allergy, I forcefully stressed that if I had taken the medication as instructed, I would have experienced a cardiac event in my sleep due to respiratory compromise. This was a critically dangerous situation, made even worse by my autonomic storms. His dismissive response and clear displeasure at my use of information, including AI, to understand these severe, interconnected medical implications, indicates a profound disregard for my patient safety and an unwillingness to engage with the full scope of my serious medical presentation. Unprofessional and argumentative conduct. During our recorded interactions, I had to ask Dr. Bates multiple times to stop arguing with me. This combative and unprofessional behavior created a hostile clinical environment. It actively prevented open communication and a proper medical assessment. A physician's role is to objectively evaluate and treat, not to argue with the patient, especially one who is dealing with cognitive difficulties due to complex medical conditions. Refusal to engage with patient-provided information, including AI for communication. When I used an AI system to help explain the full scope of my symptoms, particularly the nuances of my autonomic storms and their known connection to cognitive impairment, as my best means of ensuring he understood my complex and debilitating condition, Dr. Bates explicitly stated he didn't like the idea that I wanted to listen to an AI program and continually asserted, an AI is not a doctor. I agreed an AI isn't a doctor, but I explained its utility in retrieving comprehensive information from medical journals to help me communicate my condition when I have nothing else. His refusal to accept this communication method, despite my clear statement that If he doesn't listen to it, then he doesn't know how to treat me. Proves his fundamental unwillingness to adapt to my needs and his preference for remaining uninformed about crucial aspects of my health. 3. Your past failures and the medical necessity for a qualified authorized treating physician who collaborates with specialists. This situation with Dr. Bates is not an isolated incident. It is a direct continuation of your previous failures to provide appropriate care. After Dr. Baker's mistreatment, I endured 4 months with no proper medical care for my severe injuries, including autonomic storms. This delay, followed by the assignment of an inadequately qualified physician like Dr. Bates, represents a continuing failure by True Blue as the self-insured carrier and Gallagher Bassett as their TPA to fulfill their obligation under Colorado law to provide reasonably necessary medical treatment as mandated by the Workers' Compensation Act. The law implicitly demands that authorized treating physicians possess the appropriate qualifications and expertise to manage a claimant's specific injuries. This absolutely includes recognizing when specialists are needed and actively collaborating with them. Therefore, to correct this ongoing inadequacy and ensure I receive the specialized care my severe work-related injuries demand, I require a new authorized treating physician, ATP. This ATP must be demonstrably qualified, unbiased, and willing to effectively coordinate care with specialists. While Dr. Joseph H. Fillmore, MD of Colorado Pain Consultants, is an ideal specialist for the intricacies of my spinal cord injury, chronic pain, and autonomic dysfunction, it is understood that he primarily functions as a specialist, not as my primary ATP. My critical requirement is for a new ATP who will possess the necessary foundational medical knowledge to fully understand the severity of my MRI findings and my complex clinical presentation, demonstrate an unwavering commitment to objective medical facts, and will never falsify records or dismiss documented pathology. Be willing to promptly and appropriately refer me to the subspecialists required for my complex condition, such as Dr. Fillmore, PM&R/pain medicine, a neurologist, or a neurosurgeon. Effectively coordinate my overall medical care while respecting and fully integrating the expertise of these specialists. Dr. Fillmore's qualifications are objectively superior and medically essential for critical aspects of my case. Board certifications and specialized training. Dr. Fillmore is board certified in physical medicine and rehabilitation, PM&R, and pain medicine. His extensive training, including his residency at the prestigious Rehabilitation Institute of Chicago and Northwestern University Medical School, alongside fellowships in interventional pain and musculoskeletal medicine, provides him with the requisite subspecialized expertise in neuromusculoskeletal diagnostics and rehabilitation. This is essential for understanding and treating nerve root compression, foraminal stenosis, and its profound impact on my functional abilities. Spinal cord injury, SCI management, PM&R physicians are frontline specialists in the long-term management and rehabilitation of SCI, which is directly relevant to my linear hyperintensity/C-ranks and autonomic storms. Complex pain syndromes, including CRPS and neuropathic pain. His pain medicine specialization is crucial for managing the chronic and neuropathic pain stemming from my injuries, and these specialists are highly experienced with autonomic dysfunction like CRPS. Appropriate diagnostic approach. Crucially, Dr. Fillmore was among the specialists who appropriately recommended and advocated for the MRI of my neck, showing a correct and medically justified diagnostic approach to my symptoms. This stands in stark contrast to Dr. Bates's generalist assessment and his subsequent misinterpretation of the detailed MRI findings. This proactive, evidence-based diagnostic process is precisely what's required for complex injuries. Alignment with objective findings. Unlike Dr. Bates, Dr. Fillmore's expertise allows him to accurately interpret and integrate my objective MRI findings, severe stenosis, potential syrinx, with my clinical presentation, arm pain, autonomic storms, cognitive issues, leading to a cohesive and medically sound treatment plan. Workers' compensation acumen. His involvement with the Colorado Division of Workers' Compensation Medical Treatment Guideline Task Forces for cervical and lumbar spine injuries is a truly compelling qualification. This indicates his deep understanding of workers' compensation regulations, including the standards for medical necessity and appropriate levels of care. He understands that Rule 17 guidelines, medical treatment guidelines, clearly state the necessity for appropriate specialist referral for complex conditions like mine. Conclusion: continuing treatment with Dr. Bates is profoundly detrimental to my health. It also compromises the fair and accurate resolution of my claim under Colorado workers' compensation law. His documented misrepresentations, clear lack of specialized expertise for my severe spinal cord and autonomic conditions, and deeply unprofessional conduct render him entirely unsuitable as an authorized treating physician. This situation is further compounded by the prior 4-month lapse in appropriate care and the clear pattern of assigning physicians who are either unqualified or biased. The Colorado workers' compensation system requires competent medical care directly appropriate to the injury. A qualified ATP who actively collaborates with necessary specialists, such as Dr. Fillmore, is absolutely critical for my recovery and for an accurate impairment rating. I formally request that True Blue, as the self-insured employer/insurer, and Gallagher Bassett as their TPA, immediately designate a new, qualified authorized treating physician who will diligently manage my care and facilitate necessary referrals to specialists like Dr. Joseph H. Fillmore, MD. This is essential to ensure I receive appropriate, specialized, and unbiased medical care for my work-related injuries. I understand the process for this change under Colorado statute and am prepared to complete any necessary forms, such as the WC3 Notice of One-Time Change of Physician, if applicable given the context of prior inadequate care. I expect your prompt attention to this critical matter. Sincerely, Hawk Starchild. Phone number 970-286-2280.